Merci à tous nos intervenants pour cette journée.
I would like to thank all our speakers for this very rich day of exchange and true words. So I don't believe that in 5 minutes, I can actually summarize all the exchange, everything that was said. But I'd like to share a few words about what struck me during the roundtables and maybe the highlights of the day. It is very clear that this big idea of UHC is not going to be possible if it is not included in a true health policy, which obviously is up to the governments to implement it, but also up to international solidarity to take advantage of it and launch it. I believe these three roundtables actually showed three very specific dimensions that were absolutely crucial. So first of all, you can't possibly imagine a health insurance without quality of care. We talked about this package of activities making it possible for the people to have access to this health. And so the question is, how do we define quality? Big question. Definition of quality needs to meet some standards, and so we need to set them. And in order to be validated, we need to have certifications. In order to get a certification or accreditation, we need to have incentives, including financial incentives, in order to improve the level of quality for healthcare. What struck me also is that we need to go back to some level of simplicity. Really understand what's going on in the field, on the ground, beyond technocratic speeches and that come from large organizations. And the last thing that I believe is extremely important regarding quality is how crucial the healthcare staff is, which is lacking in the southern hemisphere, including in Africa. And that's why community healthcare agents were created. Is that something that's supposed to hide other problems? Is that a good thing? I believe that we definitely must support them, help them improve their skills, including with training sessions that could actually lead to some kind of diploma. They are suffering, they are lacking a lot of things because they cannot apply the care. So we talked about a lot of strategies. The poorest need to be able to find strategy in order to go around all these problems, in order to get access to the minimum of care and the minimum of consideration in the healthcare locations. The second roundtable was actually talking about the core of it all, which is financing. How do we fund all of this in countries that do not have sufficient means when the Ministry of Health is underfunded? So the answer is we need to find solutions. We were talking about innovative financing, but what I remember is that maybe we should talk about smart financing, because innovation just for the sake of innovation is not going to lead to anything. The smart financing systems need to be durable, sustainable. So we can see that there are some examples that are successful, but that show some limits. It's interesting to see how Ghana, VAT 2.5% dedicated to health, managed to improve the care, but at the same time we see that it's a set amount, and if you have more people in these services, then you end up with a financing gap, and sometimes the government has problems trying to find solutions. We can also complement this direct financing by free care policies that are targeted. And the question is, how do you define the beneficiary of such free care strategies? So, pregnant women, the poorest, children under 5. How do you define a poor person, an indigent? It's not because you're part of the informal sector that you're poor. And so that raises the issue of values, because obviously this question of UHC is only possible if it's actually accepted socially by the population, which is not always the case, because you can find money for something else. You can find money for a wedding or a funeral, but you may not find money to treat yourself, to go to the hospital. And so maybe we need to actually work on that, on the understanding and the question of values, including solidarity. How can we accept to pay, not for yourself, but also for your neighbor? I believe that all these questions actually show that there's a need to share the knowledge. We also need to fight against initiatives that are too individual, too separate. There's the problem of defragmentation of health initiatives, including pilot projects in terms of public health care in the southern hemisphere. Finally, private health insurance companies. That was interesting because we actually worked more on the micro level. So quite often, we need to go through these companies in order to work at the macro level. Private health companies may be a tool to actually do that. And the true question that was raised is that oftentimes they are put in the limelight in order to reach UHC. Isn't it something that's hiding something else? If the government is not going to be up to par with the expectations and it is not going to be accountable, can they actually do something against that? It seems that they're not reaching their objectives. Less than 10% of the population is actually covered by these companies, but we had explanations and true examples that were successful, and we need to actually congratulate the people in charge of them for that, and we need to leverage them in order to understand what was going on. Regarding Ethiopia, I remember the word trust. It works because the population actually trusts the local government, and also because there's a huge amount of explanation. So 3.5 million households that are taking advantage of that, even though the private health insurance companies are not mandatory, they're on a volunteer basis. It's because people have understood what's going on. So again, it's the issue of values. In Mali, the government is accountable because the authorities are subsidizing everything themselves. So little by little, you go up the pyramid. So you start with the primary care, but also make it possible for the people who need it to actually go up the health pyramid. And it's also important to have an objective, an ambitious objective, even though for the time being, we're at very low level. For Senegal, I believe that we had somebody who was full of life, very convincing for those departmental private health companies which are outside of the community level, so outside of the volunteer bases, outside of the associations, targeting or going towards professionals. And on top of that, have a scale of experience that be important enough. 276,000 people, that's significant. All of this can only work if you have the support of the government that continues what a lot of people have been touching upon, experimenting with, but we need to remember that a success at the micro level does not mean success at the macro level. So sometimes you have conditions that mean that it's possible, but if you want to actually do this at the national scale, it's much more complicated and it takes a lot of time. We have researchers that were part of this exchange, and I believe that if we were not convinced of this, we actually were shown how important research is crucial. Not only doing the research, but also being in the field, on the ground, assessing it scientifically, and then making sure that these data the evidence is actually accessible to decision makers in the field of health. So there's a lot of stuff that needs to be done. Thank you very much. Thank you to all the speakers. Thank you for being with us today. Thank you for your contribution, your input, your experience, for your questions and your perspectives and viewpoints. I would also like to tell you that this day was filmed. So on our internet website or on the internet website of other organizations, we will make all of this available. We'll also publish a written summary that will be disseminated. I would also like to thank Professor Gentilini for being with us today. He is a member of our scientific committee. Professor Tillac also, who's with us today. All our administrators who are supporting this approach that once a year we are trying to get together and talk about a cross-cutting public health issue and allowing an exchange between the North and South actors. Finally, I would like for all the speakers to come together on the stage to have a group picture, as we usually do in Africa. That's a great tradition. Thank you very much. We'll see you soon.